a second, Arianna.
Yeah.
I'd ask you if has been changing your approach in developing cooperation, in health cooperation of FIGO and UN agency, if and how, in which way?
Well, if you mean,
I mean the approach, targeted initiative, less expensive initiative. If something has changed in this.
I think that we have to celebrate Professor Sarah.
Thank you.
Because I have to say this, you know, with all sense of responsibility. He has succeeded in bringing on board international organizations to work with FIGO. And I think what it means is that we can facilitate, because as United Nations, and I'm speaking now on behalf of UNFPA, we work in 150 countries. We know the context in those countries. WHO works probably in more of those countries. So we know the context. And we know, we have experience working on the ground. And with FIGO, we can actually we can put member organizations together to help themselves in terms of South-to-South cooperation, in terms of learning experiences, in terms of being able to build their capacity across the board, in terms of policy advocacy, you know, suggesting what is happening in one country and being able to take that forward. And I think that that has really worked considerably. And from what you've heard Professor Sarah say, you know, this has succeeded in elevating, you know, FIGO from just an operating organization at the level of providing services to one which actually looks at regional and global policies.
Thank you, Dr. Delay.
Just to add to Dr. Babatunde, for the UN to associate with international and national professional associations actually opens a lot of doors. In the practice of delivery of medicine, the balance between the private sector and what public health government services provide, the UN has traditionally had a difficult time getting into the private sector and dealing with private physicians as far as the value, the role that they play, the role that they play in communities as far as setting standards, setting the tradition of rights-based as part of delivery of health services. So this has been really a huge leap forward to go beyond just the government's public health system.
Professor Soro, please.
I just also would like to add here that we also at FIGO started to collaborate with the private sector within the ethically and legally accepted guidelines. And we found this very, very helpful actually. For example, we have the support of the private sector for establishing of minimally invasive surgery training centers to teach endoscopy, for early diagnosis of diseases, for the doctors in the developing countries. And we started 2 centers, one in Sudan, which completed 2 courses, and one in Ukraine, which performed 1 course. Also, we could get the support of the private sector for activities of reproductive medicine committee, which we never had before, and that was supported by the private sector. Also, support of the private sector for development of ethics guidelines and support of the ethics committee. So you can work with the private sector, provided, of course, that it does not involve any commercial commitments or propagation of drugs or unethical ads in your various channels like websites or the FIGO newsletter or the FIGO journal. So I think the private sector can play a major role. And you have seen this at the last summit meeting on family planning, where the private sector contributed by $2.6 billion dollars, the private sector and some of the donor governments, while the developing countries, they contributed by $2 billion to provide a contraceptive to 120 million women by the year 2020. So certainly the private sector can play a major role.
Maybe if I can address the question you asked, we have seen in the area of women and children health, we have seen a transformation of our approach since 2010. Because we have seen the United Nations at the top with the Secretary General Ban Ki-moon convening an incredible process that has included all the UN agencies, but most importantly, the government of the countries where the highest burden of mortality exists, the government of the country in the north that are the ones that have the biggest capacity for contributing development cooperation, the healthcare professional association, the academics, the private sector, working in what we called eventually the global strategy for women and children health, where all these actors actually have a role to play. And this is a role to play in support of the leadership and the stewardship that government have. So this has been a complete sea change from the approach that we had in the past, where there were small projects driven by the northern donors or maybe by the cooperations that were focused on small part of countries, and even were identifying those parts of the countries as, for example, in country like Tanzania, that district is a district that is helped by the Italian cooperation, or that district is the one that is helped by the German cooperation. We have witnessed a sea change, a transformation that, in fact, my personal belief is that is responsible for what we are beginning to see in terms of health impact, which is we are beginning to see the reduction of maternal deaths below 300,000 per year, and the reduction of child deaths below 7 million per year, which we haven't seen for many, many years.
Thank you.
Can I add something?
Sure.
I think it's also important that in the last few years, under the leadership of Professor Sarah, we've also seen FIGO take positions based on evidence that has become available through the participation with UN agencies. So that when they make statements, the statements are based on facts, and facts that are made available through our collaboration and cooperation. I think that's a very important thing, because it then brings credibility to FIGO in terms of the position to take.
Thank you. It's 1 p.m. I must say that our honorable guest has to go, and you have to go. We have another press conference in 1 hour at 2 p.m. We will present the FIGO 2012 World Report, Improving Women's Health, which is this document. Most of you have already received. Thank you, then. Thank you. Then I hope to see you again in 1 hour, please.
Well, I would like to thank the members of this press conference. I know Professor Washington, he is traveling right now. So, sir, thank you very much for being with us here. Thank you very much, Paul. Thank you very much, Flavia.
Thank you. Thank you.